So this is our 8th COVID update for the community and for our employees, and we just wanted to have a conversation today about what's going on. I want to first thank everyone for continuing to come in, take care of our community, take care of everyone that's in need these days. I want to thank our community for continuing to support the healthcare system and more importantly, support the employees that work here. You guys have been so great with bringing food and funds and helping out, and we're all a team here. So back in March, I talked about, in probably our first video, about how this is a marathon. I don't think any of us really realized just how much of a marathon this would be. And so what we find is that as we're all humans, people get down from time to time, but we have people here to help pick them up. Okay, so we need to keep looking at our teammates and our people in the community. And when somebody gets down, let's all get together and pick that person up and lift them up. So I get frequently asked about the COVID trends and what's going on with what we're seeing here at the hospital, and of course what we see in testing results around the state of Florida and in our community. And I got to tell you, in May we thought we had a great story going. We had our census, our COVID census had dropped all the way down to 8 patients and 0 patients in the ICU even for a couple of days. We were all very quietly celebrating here and happy about that, but we were also preparing for a second wave in case it happened. Unfortunately, we have seen our census go the other way. We have been as high in the 49, 50 patients. Today we're at 49. Yesterday we were at 50 that are positive COVID patients. That's our highest number to date. We have 16 patients in the ICU currently. So the hospital is prepared for the caseloads that we have right now and for caseloads if they keep going up. Once again, we're preparing for worst case, which is more cases than we have today, hoping for better, that we would see a downtrend. The current trend is troubling. We've seen our census double in the past week and a half. We keep seeing record number of cases in the state of Florida come around. And it's concerning for hospitals, but it ought to be concerning for every citizen in this state. People need to take this seriously. We need to mask. You need to wear a mask everywhere you go, and take this seriously. So in this second wave of patients that we've been seeing hospitalized, we have definitely seen younger people being hospitalized. I would say the first, back in March and April, we saw a lot of elderly patients being hospitalized here, and definitely the average age was quite a bit older. We're not seeing the trend coming in from the nursing homes. I think nursing homes have largely locked down very successfully and kept COVID out of those facilities. What we're seeing right now is the general community spread, people catching it and then becoming ill and having to get hospitalized, much younger age this time. So even if a young person gets COVID, sometimes their symptoms won't manifest, so they'll be asymptomatic. But what you need to understand is that person, and sometimes they aren't asymptomatic. Sometimes they get very sick and come into the hospital. But an asymptomatic person can spread the disease just like a symptomatic person can. So when they go back and they go to their families and they go see friends and they see their mother and their father or their grandparents, that's where that's where they can spread it. And we end up with those patients here. Our staff at Sarasota Memorial is certainly not immune to community spread. We've had a number of employees here who have tested positive and are currently quarantined, but it's less than 1% of our 7,000 employees that are at SMH. We welcome those people back as soon as they get out of their quarantine, but I do want to make sure that the public knows we have plenty of staff here to take care of their needs in a very safe way. I also want to just encourage our employees to continue to be examples in the community and practice safe distancing, practice masking, make sure that we're not a part of the problem with community spread. We have a number of different processes in place to keep staff safe, our patients safe, and keep the institution operational, which is a vital piece of this answer in this disease. Some of those things are that everybody who walks into this hospital has to wear a mask or a face shield, and sometimes both. We also take temperatures every day. So if you're at 99 degrees or higher temperature, you can't come into the organization. We have shut down visitors. It's not something we want to do. It's something that we really are not happy that we have to do, but we think is in the best interest of, once again, our staff, our patients, and the institution. So I get asked frequently, what can the community do to help make a difference in this pandemic? And I got to tell you, it's wearing a mask, it's staying social distance apart, and it's doing your part. If you get sick, you stay at home. I know that masks aren't comfortable. I know that they're inconvenient, and I also know it's summertime in Florida and it's very hot outside. But we all need to make those kind of sacrifices to make sure we get this disease under control. We have a number of contingency plans on the table if we have more patients come in. If we double our COVID patients again, certainly hope that's not going to be the case. But we have plenty of ventilators on site. We have ICU rooms that we can increase our ICUs from 62 to over 100. We have those plans in place. They've been coordinated with our medical staff and our nursing staff. I frequently get asked a question if we're going to have to cancel elective surgeries again. I will tell you our goal is to not cancel elective surgeries and to continue going the way we're going. Obviously, we don't know what the future is going to hold. We are in conversation on a daily basis with our medical staff and our nursing staff to make sure that we have the right resources to be able to handle the contingencies that would be here. I do want to make sure people know when you hear the word elective surgery, it's not exactly what everyone may think it is. I actually don't like the word elective surgery. I'd prefer the word non-emergent. And I want people to know that we want to continue to do our non-emergent cases because we think they're very important to make sure that we're addressing what the community's needs are at any given time. We'll continue to look at that. We'll continue to change what we're doing to move to wherever we are in this process. So good news is that we've been able to reopen just about every part of the hospital. The last thing that we've opened up was our 6 urgent cares. St. Armand's location was our 6th and last one to open. It opened this past Monday, and we're seeing actually very good volume out there. I'm also happy to report that we have virtually all of our furloughed staff back at work, although we do have some staff who have elected to continue to work at home, but they're still back. Again, we want to express our thanks to all of our staff who continue to come in each and every day and take care of our patients and our community. We want to thank our community for your unbelievable support that you've given to this system and to the employees of this system. Thank you.